Good morning, Acton, and welcome to Java with John, hosted by Town Manager John Mangiaratti. Java with John streams every Friday morning at 10 a.m. on ActonTV's YouTube channel. You can also listen live on the radio at 94.9 FM. Tune in weekly for important information from the Town Manager, Health Department, and Council on Aging, as well as a variety of special guests. Residents can contact us with questions or comments at 978-929-6611 or email manager@actonma.gov.
Good morning, everyone. Welcome to the Drive with John program, February 12th. Don't forget, Valentine's Day is Sunday. Everybody take note. We have an exciting program this morning. We have some guests, some normal guests and some new guests. I want to just quickly run through who we're going to be speaking to this morning. We have Sharon Mercurio, our Council on Aging Director, we all know. Sheryl Ball, our Health Director. Heather York, the Nursing Director. James MacRae, our District Veteran Services Officer. And Kristin O'Neill, a Boxborough resident, working on a very interesting project she's going to tell us about. So there's been a lot happening since our last program. Hopefully you're all following the news at the state level, and we're doing our best to communicate things at a local level as it relates to the pandemic. And we're going to talk more about that in a few moments. From a town government standpoint, we're very deep into the budget planning process. The budget, I will be presenting the town manager's recommended budget on March 1st to the Board of Selectmen. So hopefully you can check that out. It's at 7 p.m. March 1st. And we have been doing a lot of exciting work talking about capital planning and finding ways to continue to deliver the excellent services that we provide with a limited impact financially. So stay tuned for that. And I look forward to any feedback that you'll have after the presentation. Another exciting thing that happened with the police department this week is that they formally received their certificate of accreditation, which is a very high mark for a police department. And it's just another example of how professional our department is. And I'm very proud, and we're very proud that they received this designation. Normally there's a big ceremony with all the peers in the police community. Now they just got a certificate in the mail, but it's still a very, very big deal, and we're very proud of them for that. Other things happening in town, we've have some new employees. I think we met Andrea last week at the program. Since that time, we've also promoted two long-standing employees that are going to do a great job for us going forward. Kristin Guichard is now our planning director and zoning enforcement officer, and Chin Ray is now our town engineer. So some new people, not new people, but people in new leadership positions, and we're really excited to continue working with everyone, and hopefully you'll get a chance to talk to them. Maybe we'll have them on the program. Sharon, what do you think? So why don't we get right to the health update? I know that's why you're all watching. I know you're not watching to see me. So let's go right to Heather and Sheryl to see what's happening with the public health news.
Good morning, John. Good morning, everyone. It's nice to see you. So the numbers for Acton up to date since last March, we've had 717 overall positive cases in town. We currently have 25 residents on isolation. A number of those have contacts that are also on quarantine. 661 residents have recovered, and sadly, 31 residents of Acton have passed since the beginning of the pandemic. The trend we're still seeing for public health contact tracing is household spread in town. So members of the same household, or folks that are doing things outside of their direct household members with other, whether it's relatives or friends in another household. That's the spread that we're seeing primarily in Acton. I wanted to just touch a little bit on vaccines, and Sheryl is going to talk some more about them. Both the Pfizer and the Moderna vaccine required a 2-dose series, as you all know. You should definitely plan ahead when you're scheduling your appointment for your first dose, knowing that you need to go back to the same site for your second dose. This has been highly advertised, and especially to us as a Board of Health who will be doing some of these vaccines. as your clinic location orders the second doses separately than we order first doses. So knowing who came to a clinic or a doctor's office, that location will then order that second dose based on those numbers that they have. So it is important to go back to your original site. After the vaccine, after you received it, you should monitor yourself as you can have mild symptoms. And the symptoms you should look for, and they should really be minor, are injection site swelling and redness, and also discomfort. You can have some symptoms that mirror the symptoms of COVID, which include fever, sore throat, muscle aches and pains, and sometimes a cough, but these should be very, very mild and shouldn't last for more than 2 to 3 days if you do get them. We've been hearing very mild symptoms from folks in the community, so that's good news. Anything beyond that significantly is a symptom of COVID, where you have a high fever for a few days, you develop a cough, or any of the other symptoms, you should consider that you may have been exposed prior to your vaccine, and you should contact your doctor and get tested to make sure that you don't have an active virus. So that's really important. After vaccine, very minor symptoms, but if you do have significant symptoms, you should reach out to your doctor. A couple of other things about after vaccination, you should definitely continue to wear a mask and social distance as we're doing now to help reduce the spread. Avoiding crowds and then avoiding poorly ventilated areas is also important to continue to do. It takes time for your body to build protection from any vaccine, and that's still the same for COVID. After your second dose, you are considered protected from the virus about 2 weeks after that second shot. So even after you get that second vaccine, continue to do all of those things that we've been doing all along to make sure that you don't get exposed right after you've received the vaccine. And again, significant symptoms of COVID, please reach out to your doctor because you may have an active virus going on. So I hope everyone is getting their scheduled appointments and staying safe. And I will see you next week. And Cheryl's going to continue on with the public health update.
Hi, good morning, everybody. So thank you for having me. So vaccine is our hot topic today. So I would like to talk about some things that the town has done as well as what the state's doing. So I just want to let you all know that the town is continuing to request vaccine every week, and we sincerely hope that we will be able to get some. We don't want our residents to have to travel far to the mass vaccination sites that I'll mention in a minute. So we've developed a vaccine working group that consists of Anita Arnhem. She's our Deputy Fire Chief and our Emergency Management Director. Sharon Mercurio, our Council on Aging Director. Heather York, our Nursing Director. John Mangiaratti, our Town Manager, and myself. We meet multiple times per week and are ready and able to conduct vaccine clinics once we obtain additional vaccine. Any future clinics that we have will be held at the junior high cafeterias. Unfortunately, we have only obtained 100 doses of vaccine, and these were used to vaccinate our senior housing residents over 75 and our homebound residents. We anticipate that once we are allotted vaccine again, that we will receive more than 100 doses. And we want to ensure that if we continue to only receive small amounts of vaccine, that they will go to our most vulnerable population. Our primary focus will be on our oldest, most vulnerable, and those without access. Rather than offering the vaccine to companions, we would ask that those that may not have access to a ride to call the town hotline at 978-929-6600 to determine if we can provide alternate plans for you. The town is also maintaining a vaccine interest form that you can find on actonma.gov. Click on the COVID-19 located at the top of the page, and then you will find the link to the form under the blue COVID-19 square on that page. This form is for residents identified in the first 2 bullets of phase 2 to complete. Once the state moves on to the other subgroups, we will update this interest form to include others. I encourage all that are eligible to complete this form, as we will use this to continue to reach out to certain subgroups once we have additional vaccine. So the next step, I'm going to talk about the mass vaccination sites. So as you may know, yesterday, companions and caregivers of those over 75 plus can now get the COVID-19 vaccine. You can go to the mass.gov/COVID vaccine website, and you can schedule 2 separate appointments at either the same time or adjacent. For the companion appointment, you're going to need to select the option, I'm accompanying someone who is 75 plus in their vaccination appointment, and my appointment is the same day. If individuals are unable or to use or have difficulty accessing the internet, they may call the 211 hotline that the state is providing for assistance in booking both those appointments. Only one caregiver is permitted to schedule an appointment with the 75 plus resident. A caregiver may receive the first dose of the vaccine if the 75 plus resident is receiving their second dose. So right now, there are appointments for next week at 4 mass vaccination locations, which include Gillette, Fenway, Springfield, and Danvers. 2 additional mass vaccination sites will be opening in Natick and Dartmouth. So you can all schedule an appointment at those at mass.gov/COVID-19-vaccine. Additionally, we're expecting our major chain pharmacies to receive the vaccine this week as well. So we're hoping that with these mass vaccination sites and with the ability for the town to obtain vaccine, that we'll be able to the town will be able to get to our most vulnerable, and people that may not have limitations could utilize a mass vaccination site. So that's all I have. Thank you, and stay safe, everybody.
Thank you, Sheryl, and thank you, Heather, for those updates. Actually, before we move on to our next topic, we got a call from a resident actually about the vaccination, and there's just some confusion about the rules as it relates to your second vaccine. Heather, can you, I think you're familiar with the question. Would you mind just framing that and answering it for us, please?
Sure, John, thank you. So the first part of that question I did cover earlier, but we'll repeat it. So the state is recommending that you go to the same site for your first and second dose of vaccination. And that's based on the clinic areas ordering first and second doses from the state as separate orders. So they'll be ordering a new first dose amount and also a second dose amount for clinics that they've already given. So it is important to go back to the same site, and that's on the mass.gov website. You can look that up for information, but they still are recommending that. The second part of that question was about injectables around the time of your COVID vaccination. So what I know from this is that anyone getting another vaccine should wait at least 2 weeks after getting the COVID vaccine. And that goes to, you should really wait until after the second dose. It shouldn't be in between the first dose, as the Pfizer vaccine is only 3 weeks apart and the Moderna is 28 days. So that puts you in an awkward spot where you shouldn't get other vaccinations between the first and second dose. You should really wait for 2 weeks after your second dose to get any other vaccine. As opposed to other injectables, such as other injectable medications or cortisone shots, I would refer people to their physician. That information is not readily available on the vaccine insert sheet. It just talks about other vaccines and the timing with the COVID vaccination. Thank you.
Thank you for that clarification. I think, and of course, if that doesn't make sense to you, just call your primary care physician, because it is, I understand there's confusion out there, but that is helpful for that info. So Sharon, why don't you tell us what's happening at the senior center this week in the virtual senior center? Thanks.
Sure. Thanks, John. First of all, I wanted to kind of hop onto the vaccine train a little bit, because with everything good, there's always people that are looking for praise. So already the companion program started yesterday, and I've seen ads on Craigslist looking to hire seniors. They'll pay you $25 to bring you to the clinic. So please don't fall prey to that. If you have a family member or loved one or a trusted neighbor that's willing to bring you to one of the mass sites, that's great. But please don't fall prey to these strangers reaching out, offering to do good, because some people in this world just aren't good. So I just wanted to get that out there. As far as Senior Center, we did a grab and go Valentine's Day lunch yesterday that went really well. Robbinsbrook provided sandwiches. We had folks drive through. Again, we had our family service officer, Michael Racklio, present, as well as Detective Stackhouse and Zane, the service dog. People really look forward to seeing that, even if it's from a distance. And it's nice to see people's faces. So we also had Joy Aguila join us. She was our former dining room coordinator who's left during the pandemic, so she was able to see folks as well. So that was wonderful. We continue to rely really heavily on ActonTV and have all kinds of fabulous programs being shown. We've got yoga and chair exercise and aerobic exercise and different lectures. So, please tune into that. Both there's a regular schedule or on ActonTV, or you can go to their website and go on demand and see whatever you want, whenever you want. Today we have an American Writers program at 11 o'clock. Monday is a holiday, so we will be closed. On Tuesday at 2 o'clock, we have a program on the Stewarts. Wednesday at 1, we have the second part of our civil rights music program. And my board, the COA board, meets regularly, and their job is to advocate for the seniors in town. And something that's come up and has been something that has been kind of near and dear to their heart is a proposed development on 67 Powder Mill Road, which doesn't sound like anything. However, the access to this development is through an easement that exists at the 30 Sudbury Road parking lot. So the easement runs the length of the parking lot. And again, there's been some safety concerns and whatnot brought up from the COA board. The selectmen did have a public hearing about it in January, but the second hearing will be February 22nd. My understanding is the developer would like to continue to move forward with this. So my board is pleading with me to just get word out to the seniors to let them know that it's happening, especially where we've been a little out of touch lately. And if they have an interest, to please attend the selectmen's meeting on Monday, February 22nd. The public hearing about the easement will be at 7:10 p.m. Or feel free to reach out to your select board with letters of concern or support. So that's it for me. Thank you, John.
Thank you, Sharon. James, what's happening with the district? And remind everybody what I mean when I'm saying the district too, please.
Well, thank you, John. Good morning, everyone. So my name is James MacRae. I'm District Director of Veteran Services for Acton and Boxborough. So I service both towns with state and federal veterans benefits for veterans and surviving spouses. So I guess I'll preface that by just saying any questions at all relating to veterans benefits, please contact my office. At the very least, we can give you an overview of benefits that you may be eligible for. Beyond that, some important news regarding COVID vaccines for veterans. The Bedford VA facility at 200 Springs Road in Bedford, Mass. Is offering COVID-19 immunizations for veterans in the immediate area. I had recently put out a mailing, and at the time, it was for veterans who are 65 and older, and they have since changed that to veterans who are 50 and older. For veterans who are enrolled in VA healthcare, please contact my office. I can in turn refer you out to the COVID vaccination hotline at the Bedford VA. For veterans who are not enrolled in the VA healthcare system, there are some stipulations for enrolling in VA healthcare. There's a geographic means test, and for a veteran who is married, even though the spouse is not eligible, combined income should not exceed $77,000 in Middlesex County. And for a single veteran, income should not exceed, it's in the high 60,000 range. Now, if you're slightly over that, what we can do is kind of a medical spend down where we can deduct any annual medical costs from one's income and see if we can get you under that threshold. So medical costs include Medicare B, that's up to now $148 and change per month. Medicare D, any supplemental coverage you have, Medex, Tufts, Blue Cross Blue Shield, and other medical costs might get you under that threshold. There are some situations that that the geographic means test doesn't matter what your income is. If you served in a combat theater of operations after 1998, if you are receiving a service-connected disability of 10% or higher, if you served directly in the Vietnam War, or if you served on active duty for at least 30 days in Camp Lejeune from August 1953 through December 31st, 1987, when the water was contaminated, if any of those apply to you, then the geographic means test goes out the window. It doesn't matter what your income is. So if anyone has any questions, please reach out to me about that. And above and beyond that, one other important thing to note is that in early January, a Veterans Healthcare and Benefits Improvement Act of 2020 was passed. And there are a lot of nice benefits, but the one that sticks out to me the most that I want to let people know about is that the VA now recognizes 3 more illnesses stemming from exposure to Agent Orange during service. So any Vietnam veterans that are listening to this and have any of the following: Parkinsonism, which is similar to Parkinson's disease, both now are recognized by the VA as illnesses directly related to exposure from Agent Orange, bladder cancer, and hypothyroidism. So if anyone listening to this has any of the following and served in Vietnam, I highly encourage you to reach out to my office to submit a service-connected disability claim.
James, thank you very much for thank you for all the work that you do for our veterans. Could you just please briefly remind the folks the phone number to reach you if they have questions?
Sure. So for any questions whatsoever on what we discussed or anything in general, please contact my office at 978-929-6614.
Thank you very much. Nice work.
Thank you.
So our next guest is Kristin O'Neill. Kristin, what's your project? I know you live in Boxborough, but you've been doing a project in Acton and Boxborough the last few weeks, and we're excited to learn more about it.
Hi, John. Thanks so much for highlighting this effort. Really appreciate it. AV Together Against Hate, the short answer is it's a community effort to show support for members of our town and encourage further action. After the racial attack on 2 Black members of our school committee in December, I began collaborating with a high school junior, Dalton Luce, another Boxborough resident, to show support for Evelyn, Abaya Isa, and Kira Wilson Cook. We connected through Lindsay Rosenman, who is a community member as well, Acton resident, and high school counselor. And we were inspired by a Facebook frame that she had created with a similar messaging. After connecting with appropriate stakeholders and organizations in town, we designed a sign of the same messaging. You can see it behind John and behind me, but mine's backwards. And the signs were printed by an Acton business and funded in large part by a generous grant from Danny's Place in Acton and other private donations. The signs are now up. You may have seen them driving through town. They're on school and town properties, as well as hosted on private properties in along main routes through Acton and Boxborough. And after the second attack in January, the Orange Ribbon campaign was launched by Kathy Luce, Dalton's mother, and the rest of the Luce family. And they chose orange ribbons as an immediate symbol of support for members of our community who had experienced discrimination. The orange ribbon is a symbol of the United Nations International Day for the Elimination of Racial Justice. This campaign was, again, just an immediate display of support for our community members who had experienced hate in any form while we were waiting for funding and approvals for the signs to go out. And I'll also add that these are not the first acts of hate in our neighborhoods, our shared neighborhoods. Over recent years, there have been many incidences of hate motivated by race, ethnicity, religion, ancestry, and sexual orientation.
Well, thanks for telling us about this program. And I guess, so the orange ribbons are out. I've seen them. We have them in Town Hall. We have them in the Town Common. I haven't seen the signs as much. I think maybe all the snow is distracting me. I have one in my office, which I've seen. What can, in addition to being supportive of the signs and the ribbons and what they symbolize, what else can members of the community do to help with this issue?
Excellent question. Signs and ribbons are a great first step, and we hope that they encourage further action. This is hopefully not just a performative display, but again, a next first step towards real change in our communities. Since I'm not an expert in anti-racist work and shouldn't be centered in the conversation, I reached out to some local stakeholders who helped me compile a list of suggested actions, some that are free, so that it's accessible for all members of our community. There are many local organizations working to ensure our towns become more welcoming and safe spaces for all of our community members. There's Fostering Racial Justice, ABSEDGE, which is the student organization, the Acton Boxborough United Way. Indivisible Acton has a great weekly newsletter that goes out with action items. Racial Justice for Black Lives, which is mainly a Facebook group. And local places of worship are also doing good work on a regular basis. Revolution Community Yoga is offering a free monthly forum, and that is accessible via their website on their community tab. So again, that's a free monthly offering in our community that anyone is welcome to get involved in. You can also connect with town leaders to voice your support of continued or improved initiatives. Right, if your children are in the school system, writing a grant for your school to further diversify classroom resources and libraries. You can create a lending library for your neighborhood to share books and start new or continue ongoing conversations about work we can do in our communities. You can support BIPOC, which is Black, Indigenous, people of color owned businesses. You can donate to or volunteer at organizations that support oppressed populations. That one might be tricky for a lot of people in our current situation. But again, there are some other free options. Like the Boxborough Library has a great social justice resource list on their website that anyone can access, and has some great reading material on there. You can celebrate the stories of historically oppressed groups and amplify the voices of those doing continuous work in our communities and beyond. And this is not a complete list, and I would encourage community members to continue this conversation, continue to share resources that they come across. And everyone brings a different perspective to this community work. And despite those varied perspectives, we're all neighbors, and we should all remember that when engaging in this work and these continued conversations. And I hope that we can all rally around the messaging that hate has no place in our community.
I think that's pretty easy to get behind. But I really appreciate your passion and your work in this area, and it's really exciting to see these signs. They're pretty sharp looking, I think, and the message was a powerful one. So please keep us in the loop as you and your colleagues are working on this. And thank you for joining the program today.
Thanks so much.
So we actually, speaking of Boxborough, many of you probably saw there was a pretty tragic fire there earlier this week where dozens of families were left without a home due to the damage to their property. So I don't have the specific link, but I know the town of Boxborough and folks in Boxborough have set up a Boxborough Fire Relief Fund. So I'd encourage you to look into that if you're interested in helping out these families. It's a horrible situation. So I just wanted to mention that. Are there any other questions from the audience or the phones? Are the phones ringing? Any questions from the group? Or do you want to call it a week? All right. I think we're off next week, or we may be showing a rerun. Either way, nice to see you all again. Happy Valentine's Day, and thank you for watching the program today. Take care.